Hi there, you're very welcome to Alba Physiotherapy. And today we're going to go through all the really deep core positions that you need for Pilates. We will be covering in different positions where your body needs to be in space to have the starting point in order to be able to really start strengthening, get more flexibility, more toning, feel better, and even recovery from injury as well. Most of the time in life, we think we know where we're at, we think we're even. And Pilates is a great way to really encourage and train the body and the brain to come together, work as one, and to actually start to strengthen up from the inside out. A lot of us are compensating with different parts of our bodies, and it means then that they become more prone to actually getting tired and sore. And that's where Pilates can really come into his own. So we're going to start today. We're going to start lying on our backs. We'll cover our lying on our backs, on our side, and on our front. There are, of course, lots of other positions that we have. As physios, we cover all of them because we want the Pilates to actually carry over in your day to day. So if you want to go deeper into these one-to-one or these sessions, just let us know. And, we've got a lot of progressions that we can do as well. Lovely. Let's start in our backs. So let's start as we mean to continue. Let's put the feet together, toes out, heels out, and that's your hip distance apart. So really important in Pilates that the brain learns where that is. And the more often you reinforce that, the more then that it will sort of embed in the brain. We're going to work our way up now and put one hand on the lower tummy, one hand on the upper tummy. So you see that there. And from here, we place an imaginary marble at the belly button. And you're going to draw the lower hand towards your upper hand and then send it away. So the marble will glide down towards your feet and then glide up towards your upper hand. Now, the key bit for this is, first of all, range of motion is nice and smooth. Always, always with Pilates, no matter what, go for quality, not quantity when it comes to repetitions, but it also means in the range of movement that you're doing, you are looking to keep it nice and succinct. So nice and tidy, nice and relaxed, as much as you can to keep the technique as good as you can. Okay. So this means with your pelvic tilt, which a lot of people know how to do, you have to keep your legs nice and relaxed. We don't need butt grippers here. We don't need toe grippers. We're relaxing the shoulders. Throughout this session today, you're gonna find little clues to where you may be holding extra tension that you don't need. Good. Come to your midpoint now. That's sort of where the body's best positioned, and midpoint for everybody will be slightly different. It might even be different throughout the week. So we'll be checking that. Now I want to bring your fingers, two fingers to your bony bits of your pelvis. Walk into and down to. And we're going to assess just now how those deep core muscles are actually firing. A lot of the exercises, especially at the lower levels of Pilates, you can look at and think, God, that looks really easy. And if it feels very easy, sometimes it's because we're not quite getting the deep stuff working. I know that most people can do a lot of these exercises without the deep core working, but you lose huge benefit when you do that. So let's assess the deep core. So from here, a little cough or a huff, and you'll feel a flicker underneath your fingers, hopefully. You need to do that as many times as you need in order to feel, is both sides working well. Now we're going to relax that area. You're going to take a breath in. Breathing is very important in Pilates because it will really oxygenate the area, really oxygenate the body, give you more energy, but it also helps activate these deep core. So let's take a breath in and exhale. And then gently draw in the lower tummy there. Good. Holding that position. Keep your fingers there at your lower tummy. We're going to do what they call the hip twisters. Just knee out to the side and back in. Other side, alternate. Lovely. Have a feel here. You may or may not feel muscles flickering on and off. We'll be assessing that as well. And this is level one. So this is great for hip rotation. This is an example of an exercise that we do on our backs, challenging the deep core. Now, while you're doing this, the toes are relaxed. We're breathing. Don't worry too much in the beginning about breathing in and out and all this kind of stuff. We just want to make sure you are breathing. Relax the lower back muscles, okay? Almost let them go, especially the ones that are attached to the rib cage. Let the rib cage placement really relax down and feel the mat on the back. As you're doing this now, I want you to work your way up so that you can feel your shoulder blades melt into the mat. Good. And then from there, allow the shoulders to swim away from the ears and the head to go heavy on the mat. That's a lovely, quick, very, very quick body scan. And in Pilates, we do lots more of that because you'll see and you'll probably feel that you're holding tension in certain areas, in spite of the fact this exercise is from a distance, doesn't look too hard. Let's add in some arms now. So we're going to bring your knees back to the hip position, arms, palms facing each other. Roll the shoulder blades back and down now. And from here, opposite arm floats out and opposite knee goes out as well. Now, what we will be doing in Pilates very much so is we look at the whole body. We get the whole body working together, but also getting the right stuff to switch off and the right stuff to switch on. And that's really important. It is as important to switch muscles off as it is on. So with this one, we're really soft through the fingers. We're watching that we're coming back to our center point. We're still breathing. Air is coming in at some point and it's going back out as well. Fantastic. And we're staying nice and lengthened through that lumbar spine, through the lower back. We always think that in order to get good core, we've got to switch it all on. We've got to be tense. We actually don't for the muscles that we're targeting today and for every day. Until you start to build up in the levels, it's actually the rest and digest cycle that we're aiming for, not the flight or fight cycle, which is what we're mostly in. So that system where we're kind of going hard all day, we got to switch that off in order to get the deep stuff working. The deep muscles work at about 30%. They do not work at a squeeze, at a push. They don't work at any of that. Lovely. And let's release the hands down. Fantastic. So that's an example of an exercise on your back where we get ourselves in a nice neutral position. And then we start to build by using the arms and legs as levers to start strengthening. Now let's go over onto our sides. Now, posture wise is as important on your back, your side, your front, as it is in standing. And we try and cover all of these positions in Pilates because it's so, so important. Now, gravity is our friend. However, it isn't always helpful. So we're going to really try and lift up through the spine now to get lovely movement here so that we can start to get the deep core activated. A lot of the times we're kind of slumped into positions, which means we don't create enough space around this core to allow the deep stuff to work. And when we really need it, so we're having to sprint or run or do something, then we'll find that we're actually pushing against ourselves or pushing down against the pelvic floor, pushing out against the core and really overworking areas that should be working well and actually blocking areas that need to work. So these exercises work really well. So you're going to check, keep the knees bent, feet together. You're going to check that this is in line with the hips. So the knees are about 45 degrees. We're going to do the clam today, but we're going to go through the neutral position first in side lying. And you're going to find, we'll do the other side in a minute, and both will feel different. So check that the pelvis is in line with the rib cage. So many times we see people where they're off center or twisted or rotated through the pelvis or the rib cage, or even one shoulder lower or higher than the other. Let's start ironing all that out and retraining the brain that that's not actually centered. So retraining the brain. What is centered? What is a good posture? So from here, check that the ears are in line with the shoulders because the minute we lie down on our side, we like to slump in, and especially if you're a side liar. And from here, let's do a little pelvic tilt. It's somewhat unusual when you do pelvic tilting in your sideline if you've never done it before. So go gently with it. Always, always with Pilates. Even if you've been doing Pilates for years, we always tell our seasoned Pilatesers start smaller and build as the class goes on. So it is about WD-40ing the area as opposed to, I did this last week, so I should be well able to do it this week. Your body is put under different demands all the time throughout your week. So some days you wake up tired, some days you wake up energized. So how you respond in these exercises, you've got to match your technique, your quality to how many reps you do and how big a movement you do. Again, we're watching for leg muscles are switched off. We're breathing. The rib cage isn't moving along with it. Hopefully you can see that. Good. Now come to your midpoint. And from here, we're going to bring our top hip towards your heel. So you're creating an envelope space here. Let's do that again. So keeping the pelvis in a nice neutral position, we're now going to lift through here. Now, I'll often find in the beginning I have to put my hand on the hip here to give me a little bit of feedback to my brain as to what's happening. And if I'm very sticky some days, I'll actually lengthen a leg and glide the foot away from the hip to help with that. Now, that movement is really, really important because we don't stand slumped. It's lovely to have a nice neutral position in one dimension, but you've got to have the length through the spine as well. And that's what keeps that going. So when you're doing these exercises, you'll always default back to these starting positions to check, has your technique been compromised? Now from here, let's see if we can get these lovely hip rotators and hip muscles, glutes fired while everything else is nice and relaxed. So sort of here down, nice and relaxed, here up, nice and relaxed, holding that position. You're going to keep hips stacked, lift the knee and lower down. And then you're going to lift a heel and lower down. If you're to put your hand on your bum pocket, that's where you should feel it. If you don't feel it, don't worry. What you can do is glide slightly forward. And again, remember, each side will be different. So you've got to stick within your comfortable and best technique or range. So if you find you're lifting that knee and you start rolling back, that's you overcompensating. And we want to really, in Pilates, start to go deeper when it comes to just exercising. This is usually time that you've given yourself, which is a great achievement for a lot of us to do. So we want to make sure you're maximizing the benefit of it. And the body needs different things in order to get stronger. Sometimes it needs a little bit of help with hands-on massage or hands-on physio. Sometimes it needs a little bit of help with the rehab. And most often it needs a bit of both. So this is where we're really honing in now to make sure that we're focusing on good technique and also figuring out when you fatigue. So at that point, my technique starts to go a bit wild. So I'm going to pause at that. Brilliant. Let's go to the other side. Let's see how that's performing, so to speak, for you. And again, let's start at the start. Find out where your body is in space. You look and see, have your feet together, check that they're in line with the pelvis. And from here, little pelvic tilting. Pelvis is in line with the rib cage, shoulder is in line with that hip, and all the way out to the ankle bone as well. It's usually about 45 degrees at the knee, but it doesn't have to be. Everybody's is different, and we'll be checking that because most of the folk that come to our Pilates class have had something happen. Life has happened. Let's put it that way. For all ages, life has happened. So we're used to seeing different biomechanics on a day-to-day basis, which we love. So everyone's biomechanics, everyone's neutral will be different. Come to your midpoint now and top hip towards your heel. Lovely. Give that a little go. Now, when you're walking or running or even moving, your pelvis has to be able to swing, but it needs to be able to be supported all the way up through the spine. But it means that as one leg is moving forward, the other leg's moving back. So movement, controlling movement around the sacroiliac is really, really important. And actually, a lot of people get L5S1. You'll know what I mean if you've had back issues. And it's because we're not utilizing this area well. A lot of us have movements in our spine where we're overusing some areas, under recruiting others. And that's where it all starts to come because we are great at compensating. Lovely. Top hip towards your heel. Now we're going to lift and lower, lift and lower. This is really targeting the hip rotators. Good. Again, hand on the pocket. Can you feel it working? Lovely. And we're breathing. We'd forgotten about that, hadn't we? Happens all the time. Really letting go, and we're thinking about getting into our rest and digest cycle. Our rest and digest cycle, if this is something that you're wondering about, ask your physio. This is so important. We are often running on adrenaline and an empty fuel can, if not partially fueled. And we're often doing things under tension, under stress. Even trying to get to a class can sometimes be a little bit under stress. And a great way to get real improvements in the body is to actually get into rest and digest while you exercise. Although it's great to exercise when you're pushing through, it's also really, really important to do it when you've got tension released so that not everything is bracing. Okay, so this is where Pilates can come into its own. It's a very subtle way, but very effective way to get the deep core stabilizers to work from all the way, really, from the big toe all the way up to the deep neck flexors as well. So if you have any problems in any areas, including out to the pinky, the Pilates will help with that. I've been doing Pilates for a long time. It was not my first choice to do it. I remember going on the first course, and I have yet to give it up. And that says it all, really. I absolutely find it so effective for so many things, but it also shouldn't set you back so that you're so sore for days afterwards. It's a very subtle way to actually get the deep core working, to get right on top of problems, but also to get strengthening as well, to feel taller and to work on that posture and bone health. Lovely. Good. Let's give that a little bit of a rub there. Well done. You now have beautiful perky bums. We're going to go on to our fronts. Now, prone is what we call on our front. It is an area that is not often exercised, but it is absolutely important because if we're not working the muscles of the back, it is difficult to understand how we can expect ourselves to hold ourselves up against gravity day to day, including in sitting and standing. But if you have any problems in on your front, or you're not used to lying on your front, then grab a wee towel. We're going to fold it up for you, and we're going to put it just across the pelvis, just where your pubic bone is, to help you get into a nice position. So you can move your block away and come down onto your front. And these sessions are so important to give us feedback as to how you're feeling. So if you're feeling that things are starting to tighten up or maybe overcompensate, you've got to let us know, because we've got 100 tricks up our sleeves with regard to actually getting muscles to work. And we can often see the problems coming. So this is not a case of pushing on through. On your front is so important to get right, because we will be using these exercises. And if you can get exercising the back of the body, the extensor sling is what we call it, you will find your posture and your strength and feeling taller you'll get there quicker. So we're going to relax the head on the forearms, if you on the forearms, on your hands, if you can, to get that length at the back of the neck. So you're drawing that jaw in and up. So it's not down, you're not tucking the chin down, but you are lengthening the back of the neck. A lot of us will go in our front and almost tip down. You're going to come back. Relax those shoulder blades. We've done a tiny bit with shoulder blade placement, and we're going to do a little bit more just now. So you're going to draw your shoulder blades gently down to your opposite bum pockets and release. Let's try that again. Draw your shoulder blades down to your opposite bum pockets. That's a thought. And release. Again, if you're feeling this in your lower back, turn the activity down. Give it less effort. Now, you won't often hear physios saying that, so enjoy it while we do. Give it less effort and really exhale as you draw down. Fab. And release. Remember, the muscles around the shoulder blade, off we go, draw down to our opposite bum pockets, are the anchor to the shoulder. If you've had any shoulder or neck issues, those guys are likely not behaving the way we want them to. Okay? And that'll cause tension along the chain all the way down the back and off and into the front. Good. Let's gently hold that position now. So you don't have to pin them down. Just come to your midpoint so that there is a gap between your ears and your shoulders. There's length at the back of the shoulder, at the back of the neck. And from here now, we're going to send our tailbone towards our heels. This will not look like it's much on camera. I'll try and get a little bit of color so you can see here. The tailbone goes down towards the heels and release. So again, you're pelvic tilting, aren't you? You're really getting that lumbar spine movement, but the mat is blocking the compensations. So that's often why this is hard. And everybody's back shape will be different. So some of us have a natural curve, some of us more of a curve, and some of us will be good in one direction and not so good in another. And that's absolutely normal. So now you're going to bring the tailbone towards the heels, hold that position, keep the shoulder blades back, down gently towards your opposite bum pockets, and release. Let's put all that together. So you're going to lengthen at the back of the neck, draw the shoulder blades back and down, tailbone towards the heels, hold very gently, relax the thighs. There we go. And release. And when you release, I want you to absolutely release. That's so important that you're getting to do that release. Good. We're going to do one more. Draw the shoulder blades back and down, tailbone towards the heels, and we're just going to hold that position. And from here, send the knee down away from the hip. And 1, 2, 3, 4, 5, kick lower. Good. Release. Lengthen at the back of the neck. Draw the shoulder blades towards the opposite bum pockets. Tailbone towards the heels. Lengthen through the knee. 1, 2, 3, 4, 5. And release. Good. And let go. Fantastic. Let's come up now onto our hands and knees if you can. A gentle arch of the back and release. Let's do a few of that now. Arching up and release. If your wrists are sore, go to your forearms. And if your knees are sore, roll onto your back and bring your knees to your tummy. Again, I can't state it. We have so many folk that can't go on their hands, their knees, move their shoulder, their back is sore. There's lots of different things. Big toe, another good one. Balance, lots of things. So it is so important with our Pilates that you utilize us as physios, okay? Get the information from us, talk to us, let us know how you're getting on. We have got lots of different ways to do things, so pushing through pain is not it. Good, and release. Fantastic. Lovely. Well, that was a little bit of a dive into core positioning on your back, your side, and your front. As I said, they're the absolute core positions. We do as physios cover lots more. And if you'd like to actually spend a bit of time with a physio to find out where your neutral is and what your compensations are and maybe how you can manage the different positions, let us know. It's well worth it. We'll be utilizing all of those positions throughout the different classes, so you get a flavor of everything, and we'll often use pieces of equipment as well, but they'll all be optional. The key bits to take away are rest and digest. This is your time. Make sure you get to use it, use us as physios, talk to us, ask us questions. We'll be helping you all the way. And the next thing then is always pitch it to what's best for you with your technique, so that you're not over recruiting or under recruiting or bracing or doing lots of repetitions, because that's not the sign of how well you're doing. The quality is. Thank you so much for joining, and I can't wait to hear how you're getting on in your Pilates journey.